Hello, all of you. We have met before quite a few times and we have chatted, discussed, debated many a topic. Today, along with me, I have Dr. Vikash Kapoor. Vikas is in Medica Super Speciality Hospital, Calcutta, one of our most valued colleagues, and in this part of the world and countrywide, without a doubt, one of the most experienced and accomplished surgeons in joint replacement surgery, and he really probably, I think what he relishes the most is the challenge of a difficult knee replacement. He's done thousands of these procedures, and of late what we have admired with Vikas is the incorporation of new ideas and new technologies. Vikas, welcome. It's good to have a chat. It's very good to have a chat with you. Because you all have been doing, good work for quite a few decades right now, and yourself in particular, along with your team and many of your compatriots. I think joint replacement surgery, knee replacement surgery was considered to be giving very good outcomes, short term, long term, doing well. Now you have again brought in this new technology of a robot, or should I say robot assisted knee replacement. Where exactly is the additional advantage?
True. Kunal, thanks for those kind words. I don't know whether sitting in front of you...
No, we have to keep him happy, you see, because as we all grow old, as we grow old, I think, something more than friendship may be needed from Vikas's side.
No, yes, I wish you never need me for whatever reasons, right. And I don't need you, especially for whatever reasons. So, personally, I mean, if you look at it from that point of view, it's quite flattering to see that a 20-year back operated knee is still coming down and wishing you luck and happiness and everything. People operated in 2003, in the early 2000s, still living happily with the knees which they've got. But yes, the technology, as you said, the robotics, we as surgeons, we have realized over a period of time that out of 100 knees, at least 2 to 4% or 5% of them start developing some issues at a very short interval. And most of us have found that these are the issues which are because of alignment, because of some kind of balancing issues, and some mechanical issue which could have been corrected during the surgery. Now, during the surgery, sometimes as a human, you may not be able to understand what exactly is going on. This is a very, very common problem which we all encounter.
It is
in hindsight.
It is a very precise geometric exercise.
Exactly.
Isn't it?
And what this robot does, it's like my third hand. So we feed in all the data from the knee into the computer navigation, and then that navigation feeds this robot data into the robotic hand. And when we start doing our surgery with our own hands, at that time the robot guides us. Basically, it's the arm of the robot which comes in and works with us on the knee to make the cuts extremely precise and balanced. It balances the knee in such a way that all time and every time we get a perfect alignment. And if all time and every time you get the perfect alignment, the chances are that this knee cannot go wrong unless somebody develops some other issue which is not related to a surgical planning or surgical alignment.
Because so it may be a very relevant question at the moment. The benefits of adding this new technology to your skill set. Are the benefits short term or are they long term?
Well, the benefits are actually long term. The short term benefits, 5-year results in knee replacements will not change unless somebody does drastically wrong alignment of the knee, which will get caught within 5 days. It will not take 5 months.
As soon as that?
Yes, absolutely. If you've gone wrong in a major way, it will get caught very fast. But usually that doesn't happen in cases of people who have done thousands.
It reminds me of our school days. We used to have a frightening thing called geometry constructions.
Yes, all of us.
Isn't it? So it's like getting a geometry construction wrong. If you got it wrong, you got it wrong.
You bisect the angle wrong, you get your results wrong. I mean, that's what my job is actually. And that's where robot kind of corrects that 5 degree or 4 degree, which makes a lot of difference when you last whether you last 15 years or 20 years or 25 years with your surgery. And that's where it takes forward. That's what we believe in. The second thing which we discussed informally was the time taken to do surgery is one point. Second is the pain, post-operative pain. It is obviously less, which we have seen in our experience. And the second thing which we have seen is the need to drill the femur is not there, like the bone. So it causes less chances of cardiac embolism is much less, which you would understand as a surgeon much better, that much lesser chest complications. So therefore, discharges are faster. You have a finite timeline in which patient starts getting better and going back home.
I think there's an interesting thing you just mentioned. When we used to compare like various approaches to surgery, whether you did 1 4-inch cut or 2 2-inch cuts, there used to be a kind of contrary opinion that pain was the same. But in your approach with robotics coming into knee replacement, is the pain less, post-operative recovery?
There are two aspects to pain. One is the anxiety which people carry with them.
That will be there.
That is a part of pain you can't remove. But definitely, if you are less invasive, and if you respect the tissues better, and robot helps you to do that, obviously the pain has been much better. The requirement of medicine has gone down. Now there are so many papers coming out that in 5 years there is not much of a difference. But when the papers come out at the end of 20 years, I think when the technology is that mature, I am sure it's going to be much more different than what it is today.
Yeah, I think that even in our country today, we have to learn to look beyond the 5 years.
Yes, because obviously.
Obvious reasons, because whether it is in my line of work in cardiac or in your line of work in orthopedics, today you don't really fall from the skies when you see somebody who's fit and healthy and walking around at 75 years of age.
And if you look at what we had when we were born independent, it was 40 years we had life expectancy.
Exactly.
And today you are living at 70. By the time we are up and about to get lost from this world, we would probably be looking at 90 or 85. And at that point of time, we have played our crickets and footballs and misused our knees. And by the time we are 50s and 60s,
I mean, basically, quite.
So how do you go to 90? That is the biggest problem.
Actually, our ideas about what is long-term follow-up, that needs to change.
Yes, that has to change. It's changing in all the branches.
It is changing.
I think people are getting revision heart surgeries done after 20, 15 years. They are coming to you. They are coming to experienced people. So robotics that's where it fits into our job, to give a longer insulation to the surgeon. To get the patient
with robotics, with new technology, whenever you incorporate new technology, like at a time when we used to stop all the hearts before operating, then we learned beating heart, everything.
Absolutely.
Now every technology comes with a little caveat, and that caveat is a learning curve. So is it a very steep learning curve, or it's not that difficult? Really?
I think it is not at all difficult.
It's not.
I don't know. It is again depending on how much work you've done previously.
Okay.
And the second caveat, which is a favorite caveat for people, is the cost. Isn't it?
It is.
So, as I think the cost is in this country, we are fortunate to have technology at a price which you cannot imagine. So in this country, you get extra, maybe as less as $400 is the extra charge. So like 35,000-40,000 rupees is the extra cost per knee, which actually boils down to nothing when you compare to the larger context of total knee replacement as a surgery. So I think we are well within our cost limitations as far as technology is concerned. The only concern here is the insurance, especially the national insurances. Some of the private insurances are quite good, like they do honor this robotic technology, but the national insurances, I think we should appeal, and they should bring in this particular clause.
I think you are absolutely correct, and it is you who has mentioned this very critical point, and we must appeal to all our national health scheme and insurance agencies that look, there is no point making technology in India unless that technology can be applied in India.
And is accessible to common mass. I mean, why does X type of person is denied of technology and Y type of person gets the technology just because they can afford it? If it is there,
it may be a little bit of a crude thing to say that when you fight in the skies, you prefer a Rafale to a MiG.
Yes.
So now you want a person to walk, to have the next 25 years of his life as an active quality life. I think as we prefer a Rafale to a MiG, we must also express that same appreciation for technology, not just in war but also in life.
Yeah, and if it is a permitted technology to be used in the country, then it means it should be available to everybody. It should be vetted by the common masses.
I'm sure it will be as a matter of time.
In fact, they are going for it. They are paying out of pocket for it. That's all. And which is something.
Yeah, but I think the future of civilization is when the out of pocket gets down. Not
I think we are absolutely concurrent on this. We are very passionate on this point.
So Vikas, one more thing before we coming to the end of our discussion is you've already done a very substantial amount of work in this area, and it is not just from your mentorship, your proctorship or everything, but having really done a substantial amount of work. Do you see the proof of the pudding in the eating? Are all the benefits?
The short term are definitely there.
Okay.
The pain is less. They go home much faster. There is much less cardiac or breathlessness which I used to see in the patients. And they recover within a month to where they used to recover in 1.5 to 2 months. So that part is what I am seeing today. The long term result, may God bless me with that life and I should be able to see that.
I'm sure you will. I think, it's a matter of great pride and joy that even we, who's been around for a jolly long time, are living through a period of technology transformation. Like we moved over, from dialing the plastic phones
I'm
to
sure
the,
most of them have not
to the mobile. Most of them haven't seen it perhaps, to using an Android and a touch screen today. Technology moves on for medicine as well. And it is people like Vikash and his team who's applying this technology to areas so critical to us in complex operations like joint replacements. And I'm sure hundreds and thousands of people are going to benefit from it. Vikash, keep up the great work.
Thank you, Kunal. Absolutely. Pleasure.